Welcome back to the show. This is it was going to be take 2. It could be about take 14 at this point. Lots of different internet glitches out in the interwebs today. I have Dr. Tim Jackson here with me, and we're going to talk about burnout. We're going to talk a little bit about brain fog and all of those hidden things that could be contributing to it that a lot of times people might not even realize, right, Tim? Like, I'm sure you're seeing this with clients a lot.
Yeah, absolutely. Thanks for having me. But yeah, I see this a lot with clients and people every day who may not be performing, to their best, or may have, something that's totally unrelated or they think is unrelated, such as relationship issues, because they just simply don't have the energy to show up. And so, burnout, there's multiple causes, and it's usually not just one thing. There's everything from mold to stealth pathogens to gut dysbiosis to hormonal imbalances that all contribute. And so, for one person, it may be mostly gut dysbiosis and stealth pathogens. For another person, it may be mostly mold.
So true. How did you get into this? Because I think this is something we're seeing a lot more of now, but I'm assuming this is your own journey that kind of got you here, correct?
Yeah, a colleague an MD colleague of mine handed me the book Mold Warriors in 2009, and he wanted me to read it and let him know what I thought. And so I tested after that, and I had done the GI effects test for Metametrics at the time, and it said +3 for Candida, but then underneath they had an asterisk that said may also indicate mold. And so, I grew up in the Southeast. I've lived in the Southeast most of my life. And so, there's no telling where I was exposed. I'm sure it was multiple places and not just one. But I got interested in it because I found the more I tested for it, the more I found it to be contributing. And if you're treating someone with chronic infections or even cancer or any neuroimmune disorder, it'll be exponentially easier to achieve your therapeutic outcomes if you detoxify the mold first.
Makes so much sense. And I think a lot of times it's one of those things that people don't even know to look for it. And they're going to be at a functional provider, somebody out a little outside of the mainstream that are looking at things differently. So you spoke about the test, and it might be, like myself, I've done the urine test, and that is how I kind of figured out my mold issues. But let's go through and deep dive into, once we get those test results, if we see that maybe mold is an issue, how do we start to figure out if it's past exposure, if it's current exposure, and the importance, because you probably see it as well, where people, it's difficult for them to actually decide it, even though it seems like it shouldn't be, if they are currently being exposed. I mean, it's a big, right, a big thing to have to move or do whatever it is, but why it's so important to do that. So let's go through looking at the test results, figuring out how to figure out where it is.
Yeah, so basically when you receive your urine test results for urine mycotoxin test, you can't say, what percentage of those mycotoxins came from present exposure or current exposure and how much came from previous exposures. So I recommend everyone get their home, and preferably their home and office if they work outside of the home, tested. And so you can start detoxifying the mold right away. But if you're still living in an environment where you're being exposed, you're basically just treading water. And so the best test for home, usually you want to look for a company that uses multiple testing methods. So you can use an infrared camera to look behind the walls for increased condensation, because most of the time, most species of mold, you won't be able to smell or see. Obviously, black mold, Stachybotrys, you can see that and smell that. But you want to look behind the walls for areas of increased condensation. A lot of people think, because their house is 3 years old or 4 years old, they can't possibly have mold. But that's just not true. If you look in most neighborhoods, they put up the framework for a house, and then the construction crew may not return for 2 or 3 weeks. And so during that time, it's being exposed to the elements, it's collecting moisture. I will say that, there are more and more companies coming out with materials that they create to be less conducive to mold growth. And so that's a positive note. But back to the testing of the home, you want to look behind the walls. You want to have them check your ductwork. You should have your ductwork cleaned preferably twice a year anyways. But you want to test for any current mold in the ductwork. And then usually they'll do air sampling and or a vacuum sample.
Right. And then how about the companies that are out there that kind of do the testing and then the remediation too?
So that's some states, depending on where you are, that's illegal. It's not illegal in every state, but it can be a conflict of interest because, with the camera, you can tell exactly where the moisture is. But if you're doing the testing and the remediation, they may come in and say, let's tear down this whole room, and so it clouds their judgment, in my opinion. So I always recommend that people use a different company for testing and remediation.
How about with the remediation, right? Because there are so many different ways to do remediation. And sometimes, we're just talking mold today, but there are so many different toxins that we are exposed to on a daily basis. And we want to make sure that we're doing and remediating it properly, right?
Right. Yeah. So, a lot of times people ask me about ozone. Ozone definitely kills mold, but when you kill mold, it releases dead mycotoxins, and those are still immunogenic. So they're stimulating and stressing your immune system. Whereas my preferred method is biodegradable enzymes. They essentially are like little molecular Pac-Mans that eat the mold and mycotoxins. And, that's a safer way. You really don't have to be out of the house when they do that. I mean, you can be, but with ozone, it will get rid of the mold, but it's also, it can trigger an immune response as well.
How about, let's just go some of the basics. What are some of the symptoms people might be having if they're dealing with mold toxicity that they might not even realize? I think of it, I'm in Michigan, so people are like, well, we have the winters here, so things are freezing. But the fact of the matter is we have very humid summers. We have no-till crops. And then also being in a home all winter long can create issues as well.
Yeah. And with the, snow that you guys receive, because there's usually not enough heat to cause evaporation, that water can seep into the foundation and get underneath the house. So, you can have a well-constructed home that's right on the beach that doesn't have mold. You can have a poorly constructed home that's not well maintained, that's in the desert that has mold. And so some of the first symptoms you typically see: insomnia, like severe insomnia. That's one of the classic ones. Brain fog, fatigue, mental and physical fatigue. Even when you do sleep, you don't wake up feeling rested. You can have GI issues. You can have mitochondrial issues. So, all the systems that are mitochondrially dense, like the cardiovascular system, they can start to malfunction. And the mycotoxins block a pathway called NRF2, which, as you know, I'm sure you talk to your patients about, it's how our bodies produce antioxidants and detoxification molecules.
Yes, so important. And so many of those symptoms people can chase with all sorts of other different meds, right? And if you never get to that root source, I mean, I know for me, it was a night and day difference. So when I saw it on the labs, I was like, all right, this is great. Let's just start clearing this and going and healing through that. So let's deep dive into that. What are the best ways for, if people do find out like, hey, this is something I'm experiencing, we're going to go through and do some remediation. And can we just say, like, if you've got water spots in your house, it's pretty much 100% guarantee you got something going on there.
Yeah, absolutely. And I mean, if you've had water damage, even that was cleaned up right away, there's a good chance you still have mold. But I've worked with people who have, multi-million dollar homes, and they think that, having mold is an indicator of how clean your house is, but it really has nothing to do with that. And so, it's not an insult if, you or I suggest to a patient, hey, you might have mold, we should look into this. So we have to take that seriously. And, it may be a situation where you do have other things like hypothyroidism or gut issues, but mold is what's driving the bus, so to speak.
Yeah. And it's one of those things that you can chase through, like or chase through the thyroid issues. You can chase through the adrenal for the fatigue. You can take, melatonin until the cows come home for insomnia. But the fact of the matter is like, if we don't clear this gut issue, or not gut issue, this whole issue, and also address the gut too, right?
Right.
We're never going to see true healing. So you saw definitely a correlation with gut dysbiosis and those other issues along with mold, correct?
Well, so what I found, and this has been sort of a progression through the years, is that the gut dysbiosis, you can't change it or mitigate it until the mycotoxins are gone. And I wrote an article, I think back in 2012 or 2013, on how mold affects the gut. And one of the main mechanisms is it lowers a hormone called alpha melanocyte stimulating hormone, which is a neuroregulatory peptide that decreases inflammation and keeps peristalsis, the wave-like motions, going through the gut. And so typically when mold is present, it's going to suppress the immune system, and that's going to allow candida, to grow out of control. And both mold and candida produce oxalates. So then you have sort of three issues that are all tied together, coming from the mold.
Yeah, and we can watch the oxalates in our food, but if we're not doing anything with this, then it's not going to really great. What about with
Right.
heavy metals? What do you see correlating with that?
Yeah, so the metals won't come out. And here, I'll save everyone listening $5,000 or $10,000. I tried chelating heavy metals and they didn't budge until I got the mold out.
Ta-da.
And it has to do with the molecular weight of the substrates and the compounds. But take it from me, firsthand, get the mold out first, because it's going to cause so much inflammation when you have mold. The higher the inflammation levels, the lower your detoxification capabilities. And so getting rid of the mold first, and then the metals second is best.
Yeah. And also then we deep dive into parasites and all of them. Like it's like the whole little 3-prong approach there. So how do you do this all through stages? I'm assuming you probably use cell core as well, correct? I think from our last conversation, like, I love those products because that's really the first thing that I found. Same thing after tens of thousands of dollars of things trying to help heal a leaky gut. And those things were the ones that just finally within a very short time period, I saw the most results.
I know a doctor who's, I think, the first shoemaker trained doctor in the United States. And he doesn't use cholestyramine anymore. He uses cell core.
That's pretty cool to hear. That's really, and it's one of those things, like I had met both Dr. Todd and Dr. J at a seminar one day. And obviously them being chiropractors, I just totally like resonate with them. Right. And so Todd was sitting there talking about strongyloides and that parasite. And I was like, "Ooh, fill me in on this." And then I was like, I need to know what you have. Like, I need to use these products. And it's amazing to me because I will look back at pictures and just how puffy and inflamed I was. And it was just because it was that perfect storm. And so no matter whatever I was trying to do and, chasing my thyroid, chasing my adrenals for my energy, nothing was helping until I really got, and I did quote unquote parasite cleanses every 6 months for the last, 15 years, but never saw any changes. Not like with this company, right?
Right. Yeah. I mean, it's all about the details. They use, obviously, mimosa pudica seed. It has to be the seed. And so the devil's in the details.
Right. And their carbon technology, like it's so, everything is just so brilliant. Awesome. What else or what other nuggets of information do you have for everybody as they're going through this little, I've been using the word biohacking a lot lately. And then I realized some people don't understand what biohacking is.
Yeah, I used it in front of my friend who is in functional medicine. He's like, "Are you hacking into people's computers?" I'm like, "No, no, no, no." But as far as mold goes, and I don't have any affiliation with the company, but I recommend the Air Doctor, which I
Yes.
have behind me. It's been a game changer in terms of most of there are other air filters that can be almost as efficient, but they're 2 to 3 times as expensive.
Hmm.
And so I really recommend the Air Doctor. Depending on the size of your home, you probably want one on every level. It's better to have, several smaller ones than one large one. And, a few feet away from the Air Doctor, I like to have a dehumidifier. And where I am in the South Carolina, in the Southeast, I run the dehumidifier constantly and I empty it 2 to 3 times a day. And you
Wow.
want to keep the humidity below 50%. You don't want it to go above 50% because that, allows mold growth to occur. And then to throw another wrench into this situation, you have the EMFs, non-native EMFs, 5G, Wi-Fi. And, Dr. Shoemaker, or not Dr. Shoemaker, Dr. Klinghardt did an experiment where he exposed mycotoxins to EMFs, and they produced 600 times more mycotoxins when they were exposed to EMFs compared to baseline.
That is insane. Because it is everywhere now. You know what I mean? I
Yeah,
think like I live in a condo development. I've got probably 15 Wi-Fi signals being thrown at me all at once. And so I sit
right.
here and think of like, what can I do? And I do everything that I can here for my own space. But it was like, other than going to all my neighbors saying, can you please turn off your Wi-Fi? It's
Right.
difficult. What do you suggest on situations like that?
Yeah, it's tough because even let's say if your home is bulletproof in terms of EMFs, as soon as you walk outside, you're being
Mhm.
bombarded. There's a brand of clothing called Lambs, and they've been tested, with physicists and biophysicists against EMFs, and they don't completely mitigate it, but they certainly help a lot. And I know they have, t-shirts, they
Mhm.
have hoodies or beanies for your head. They have bras for women, boxers for men. And so those can help from a structural standpoint. And then, taking plenty of molecular hydrogen water is one way to offset some of the exposure to EMFs, and fulvic acid as well. So those
Yeah.
are two sort of supplemental angles.
Yeah, I love hydrogen water. I start out my morning with that every day.
Yeah.
And it was, one of my patients had introduced me to the clothing line because it was when they were pregnant, they were worried about, obviously EMF exposures to babies. So they're like, what do you know about these? So, there are all sorts of things out there to scope out. So that's awesome information. All right. Where can they find more information about you?
Yeah. So healyourbody.org or .org. It's https://. I think you'll put it in the
Yeah.
links,
Yeah.
but healyourbody.org. And if they use the code Dr. Lisa 10, I'll give them a 10% discount on an initial consultation.
Great. Well, thank you so much for your time today, Dr. Tim. Very informative.
Thanks for having me, Dr. Lisa. It's a pleasure.